Blackheads, also known as open comedones, are one of the most common forms of acne, and despite how simple they look, they are surprisingly difficult to treat correctly. In today's video, I am going to tell you 5 science-backed ways to treat blackheads and then go over 2 treatments that you may have used already that don't actually work as well for the long term. I'm Dr. Morgana Colombo, board-certified dermatologist and founder of Vida Derma, a skincare line which is science-backed for aging skin. Let's get into it. Blackheads form when pores become clogged with oil and dead skin cells, and when the material is exposed to air, it oxidizes and turns dark. The key to treating blackheads effectively is not just removing what you see, but preventing new ones from forming in the first place. The most effective treatment for blackheads is topical retinoids because they address the root cause of clogged pores. Topical retinoids such as tretinoin, adapalene, and tazarotene are considered the gold standard treatment for blackheads. These medications work by normalizing how skin cells shed inside the pore, preventing the buildup that leads to the comedones. Unlike treatments that only clear what is already visible, retinoids actually stop new blackheads from forming. Clinical data shows that consistent use can significantly reduce microcomedones within weeks with continued improvement over time. However, they can cause dryness and irritation early on, so starting slowly and using a moisturizer is essential for long-term success. Benzoyl peroxide is the second of 5 science-backed ways to treat blackheads. It helps reduce blackheads by targeting bacteria and mild pore blockage. Benzoyl peroxide is widely known for treating inflammatory acne, but it also plays a role in managing blackheads. It has mild comedolytic properties, meaning it can help break down clogged materials in pores. More importantly, it reduces acne-causing bacteria and inflammation, which often coexist with comedones. Lower concentrations, such as 2.5%, are typically just as effective as higher strengths while causing less irritation. While it is not as powerful as retinoids for preventing blackheads, it works well as part of a combination regimen. The third way is through combination therapy. One of the most effective strategies for blackhead treatment is combining a topical retinoid with a benzoyl peroxide. This approach targets multiple steps in acne formation at once. The retinoid prevents new blockages, while benzoyl peroxide reduces bacteria and inflammation. Studies consistently show that combination therapy leads to greater reductions in total acne lesions compared to single-agent treatments. In addition, using a fixed-dose combination product can improve adherence, making it easier for patients to stay consistent and see results faster. A fourth option is salicylic acid. Salicylic acid is a beta hydroxy acid that penetrates into the pore and helps dissolve the mixture of oil and dead skin cells. This makes it a valuable option for patients looking for an accessible non-prescription treatment for their blackheads. Salicylic acid is commonly found in cleansers, toners, and leave-on products. While it is not as potent as prescription retinoids, it can still provide measurable improvement in blackheads, especially when used consistently. It is also generally pretty well tolerated, making it a good starting point for individuals with sensitive skin. Before we get to the 2 biggest treatment myths when it comes to getting rid of blackheads, let's talk about azelaic acid. Azelaic acid is often overlooked, but can be particularly helpful for patients dealing with both blackheads and post-inflammatory hyperpigmentation, discoloration. Azelaic acid works by gently normalizing keratinization within the pore and reducing inflammation. Although its comedolytic effect is milder compared to retinoids, it offers the added benefit of improving uneven skin tone, which is especially important for individuals prone to dark spots after acne. This makes it a strong option either alone in mild cases or as part of a broader treatment plan. Now, let's get into the two myths. Myth number one is squeezing blackheads as a way to treat them. The common belief that squeezing blackheads is an effective treatment is a myth that can actually worsen the condition. Manual extraction or squeezing blackheads at home is one of the most common habits people rely on, but is not an evidence-based treatment. While it may provide temporary cosmetic improvement, it does not address the underlying processes that cause blackheads to form. In fact, improper extraction or too much squeezing can damage the follicle, pushing debris deeper into the skin and triggering inflammation. This can transform a simple blackhead into a more severe lesion, such as a papule or pustule, and increase the risk of scarring or hyperpigmentation. Professional extraction performed by trained clinicians can be used selectively, but even then, it is considered an addition rather than a primary treatment. Myth number two is about a common over-the-counter product that people buy all the time. Nose strips are popular because they create an immediate visual result, pulling out material from the pores. But nose strips only remove superficial debris, not the underlying microcomedone that will eventually refill the pore. They do not change oil production, skin cell turnover, or the biological processes that lead to blackhead formation. As a result, any improvement is temporary. So there is also limited clinical evidence supporting their effectiveness as a treatment. In some cases, repeated use may even irritate the skin or disrupt the skin barrier. The most important principle in treating blackheads is consistency and targeting the underlying cause rather than just the visible lesion. Blackhead treatment is not about quick fixes, but long-term control. The most effective therapies work by preventing new comedones from forming, not just removing existing ones. This is why topical retinoids remain the cornerstone of treatment, often supported by agents like benzoyl peroxide, salicylic acid, or azelaic acid. Most patients begin to see improvements within 8 to 12 weeks, but continued use is necessary to maintain results. Understanding this distinction between temporary removal and true treatment is what ultimately leads to clearer, healthier skin. What questions do you have about your skin? Drop them in the comments below and I will do my best to do a future video on it. Remember to hit like and subscribe, and I will see you in the next one.